Now what we're going to look at is sinus augmentation. A lot is said about sinus augmentation. I learned initially about 25 years ago lateral windows from my mentor who'd been doing them in the mid-80s, early 80s. So it's been around with us for a long time, and it's a very consistent, very stable procedure initially conducted by Hilt Tatum in the early days. Right, preferably it's important to learn about a lateral window access, mainly because if you need to remove a root or an implant, you need to be able to access the sinus from the lateral window. I know there's a lot of newer techniques, and I will show those being used with certain materials and certain protocols and certain tools where we can do more crestal approaches now, which generally mean less surgery and also can lead to less post-operative swelling rather than making a lateral window. But for the last 10 years I've used DASC lateral window for lateral window access, and it makes it consistent, safe. I think in 10 years I do one, maybe two a week, and I think I've torn probably 3 to 4 times that the lining is torn. So it's very consistent, very predictable, very safe once you learn the technique. So this is, a lot's changed since when I first started. When I first started doing sinus augmentation, I used to sit on the edge of my chair with anxiety. Materials and protocols have changed this a lot. And the materials that I feel have changed have been the synthetics and have been the materials like Ethos, especially Ethos, which is osteoinductive at turning over to host bone. Because this material, also being biocompatible, leads to reduced swelling and reduced pain in the sinus. As well as if there's a small tear in the sinus, it doesn't really matter that much. The material's stable, it tends to stay in one place, and the lining just heals over the site. We've done about 20 cases like that. So essentially, yes, I'm using a lot less lateral windows than I used to because I'm developing my skills more using Versa and internal lift techniques. It's important to be able to do it just if you need it in emergency even. One thing to watch out for a very well-defined artery in the lateral wall. You can get a bleed, and if you do, don't panic, just deal with it using pressure. So the case I'm going to sort of show here really is why the benefit of Ethos over other materials. It's well recorded that literally anything will work, from PRF to, and even some people say nothing will work, but I prefer to place something in to A, give a scaffold, and B, help the host regenerate. But anything will work in the sinus. It's just an ideal environment for bone regeneration. When we actually are using a material that doesn't resorb, say for example an HA or a xenograft, we will get a better picture, but we have considerably less bone. The systematic reviews, the most extensive one done in Germany by Wang Homle Chan, suggests up to 40% less host bone. So is a great picture an important aspect? No, I don't think so. I want a true picture. I want to know exactly really what is going on. What I see must tell a good story. The other good thing about using Ethos is it's multifactorial. So we're not just grafting the sinus. We're actually going to be, we can use it to raise the platform, so we've got a better platform. We can graft adjacent teeth. It seals the window. So what we can do is get the material to help us do many functions, not just doing the sinus augmentation. And that shows in this case, in this video we're going to show. And here we've lost a lot of bone. The sinus is right on the implant, so we've got 2 millimeters of residual bone. We've got a mobile tooth distal, so we're going to stabilize the mobile tooth. We're going to fix up defects. We're going to do the sinus, and we're going to do it all in one 20-30 minute procedure. This is the benefits of using Ethos in these situations. So it allows me to merely clean the site, raise a flap, place the implant, graft using Ethos, graft up against the adjacent tooth, graft in through the lateral window, and load it at 9 weeks. The other benefit, as we see in all our cases, that we get an improved keratinized, attached keratinized soft tissue without doing any free gingival grafting. So again, this is another benefit of the materials of helping regenerate host bone, letting the host deal with the soft tissue itself. And in this particular case, we can see that we've got a nice keratinized cuff without doing any free gingival grafting. Case is loaded 4 years now and has got very good stability, very good hard and soft tissue, both in the sinus and up against the adjacent tooth, which was periodontally involved. So the whole idea is to not place the implant all the way in, but to leave the implant 2-3 threads out so that we can grow the bone vertically. Because an important aspect is not just regeneration of the implant, it's raising the platform so that you have a good sized tooth. You don't have a massive big molar, because we want to get a level platform, and that's just as important. And also we want that soft tissue to improve so that we don't have peri-implantitis, or we don't have issues in the future, because we've got nice attached keratinized tissue. And the slides that we'll show how we routinely do this by raising the platform. So we're growing vertical on the maxilla at the same time as we're grafting into the sinus. And that can be taken even further. So the case where we'll show this is where we had a recent extraction, and I went to place the implants into the sinus and graft, but there was only 1 millimeter of residual bone, and while I was just placing a pilot, I went into the sinus. So I socket grafted and just left the case for 10 weeks. Now, I came back, and as you could see, in 10 weeks' time, we had 6-7 millimeters of high quality new host bone. And this is important because this then allows me to use an internal technique, because now I have enough bone to A, get stability, and B, to be able to drive the bone and further graft material in using whatever technique, whatever tool I want to use, whether it be the DASC internal or the Versa, which I'm using more and more of. When we looked at the case after 10 weeks, there was very good keratinized attached tissue as well. And when we raised a flap, we could see the quality of the bone. The bone was very high quality, very little residual graft material. So this allowed me to use Versa. When we're using Versa and Ethos, you must make a very dry mix. And you just use a spatula or use the syringe to place it in the site, and then just using the Versa, drive it in. I like using 150 in reverse. Some people like to use a little less. But again, it's important to make a slightly drier mix. And then the great thing about it is, after placing the implant, you can then help the host grow the bone vertical for a better platform. And again, so we don't put the implant all the way in, we leave 1 or 2 threads out so that we can grow vertically to attain this improved platform as well. And you can see in this particular case, we've done that again. The case was then loaded with a screw retained crown, and all was satisfactory. So we've taken from a socket graft to being able to have enough bone to get very good primary and be able to use an internal system. And here it is loaded at 2 years. And again, you can see now we've got no residual graft. You can see the great soft tissue, the great keratinized tissue, and you can see the new cortical plate where we've lifted the bone up internally, as well as the new vertical growth of bone. So this is going to be a really good long-term stable procedure, done very easily. Yes, over 2 procedures, because the lack of host bone prevented me placing the implant. Another thing, whenever we're placing implants using a lateral window, I think it's always best, or I always try and actually get the placement of the implant at the time, because what we're doing is effectively helping the host regenerate its own bone. But the forces, the pneumatic forces in the sinus, can be very high, and these forces can remodel the bone. And this is why it's important to get the implants in at the same time of grafting, if you possibly can. Yes, if you do it the other way, it will be fine, but you may lose some volume. But what you're gaining is bone quality. And bone quality is something us dentists tend to ignore, because we look at everything in radiographic images as something being radio opaque. But it's important to have high bone quality, because in the sinus, this bone is constantly going to be turning over. Far better to not have any residual particles. As I say, greater picture, but I think it's better not to have any residual material. So these are my thoughts on sinus augmentation, and I do think that especially in the sinus, it's nice to not have foreign material. I've had a lot of cases come back with long-term issues involving residual graft materials somehow being left in the sinus or floating loose. And this can create a lot of problems, and I use an ENT for this. Sometimes we have to get bits and pieces out of through the ostium. But the benefits of having a material that just upregulates the host healing, turns over to bone, but can be used to actually help the host regenerate vertically as well at the same time to get a better restorative platform is just an absolute benefit. So this is why we're very, very happy with the outcomes with sinus augmentation and Ethos.